Dr. Jolie Silva here. I am doing an interview today with Denise Lemongello. She works for Center for Discovery Eating Disorder Treatment, and she has private practice where she works with a lot of eating disordered clients, people with disordered eating. So I am so happy to have her with me today. Hi, Denise. How are you?
Hi, I'm well, thank you. Happy to be here.
So for some people watching this who might not be as familiar with eating disorders, there is something also called disordered eating. So can you
hmm
just explain the difference between an eating disorder and disordered eating?
I think it's a really good question. And I feel like that's something I have to bring up a lot, especially when I'm doing family sessions, trying to educate families or spouses on how to support their loved ones, that there is a great deal of disordered eating out there. And it doesn't mean that someone has a full-blown eating disorder. So by disordered eating, I think it's just a lot of people who have gotten into really bad patterns from a lot of really misleading misinformation out there about what's healthy and what isn't. So people, also people's lifestyles can prohibit them from taking proper meal breaks, or so they end up sort of eating on the go. But really, the difference is when it is a full-blown eating disorder, it's almost taking on the life of or the life form of something like an addiction, where it's really getting in the way of someone's life and it's impacting everything from their work, their finances, and most importantly, their relationships.
So I think most people have heard terms like anorexia and bulimia. But, in my clinical work, I do find that there is a misconception about those things. People assume bulimia only means you're eating and then vomiting afterward. Can you just give us a brief explanation of what anorexia is, what bulimia is, what binge eating is, and then also you mentioned something called orthorexia, which I think is not a term many people are familiar with. So can you just give us a little education on what those different things are?
Sure, I'd be happy to. And I love debunking myths about anorexia, because most people assume that anorexic uh, symptoms mean you don't eat at all, and that's not true. Anorexia is marked by very, very restrictive, ritualized, routinized eating, but even your most restrictive anorexic is definitely still eating every day, just in a very, very specific way. So that is the myth. So I've actually seen a lot of patients who come to me not realizing they have an eating disorder, and specifically not realizing that they are anorexic, because they are still eating every day, even if it's, something as restrictive as, say, 400 calories a day spread out over these teeny tiny little meals. That's just definitely not enough food for one day for your body to carry out basic functions. So anorexia just sort of characterizes restrictive eating, but it is still eating, just a very, very severe restriction of calories. And often what comes with that is people are living in much, much smaller bodies and eventually underweight. It is no longer part of the diagnostic criteria that you have to be underweight to be considered anorexic, but typically that is what will ensue is extreme weight loss, and then maintaining a smaller weight. Bulimia nervosa, bringing us to another pillar of eating disorders, is I think you did a great job of pointing out that it is a myth that bulimia is just purely self-induced vomiting. It's When we talk about bulimia, yes, we do often talk about eating large quantities of food and then expunging that food. It's a deliberate expunge of calories that takes place after a binge and when you are experiencing bulimic symptoms. But the difference is it doesn't have to be self-induced vomiting. It can be over-exercising. It can be restricting heavily, fasting. It can be taking laxatives. I mean, there are so many different things that people can do to expunge calories. So I've actually worked with a great deal of men who just over-exercise after planned binges or sometimes unplanned binges. Sometimes the binge is the failed attempt at restriction. But I think when there is that deliberate compensatory behavior to get rid of food just consumed, that is the bulimia. Okay, so those are two main diagnoses that we see very, very often in eating disorder treatment. I will move on to define orthorexia, which is sort of more of a newly recognized diagnosis. And orthorexia has to do when people are obsessed with healthy eating. So when healthy eating takes on a life of its own and becomes an obsession that leads to a restrictive lifestyle. So I give a great example of someone struggling with orthorexic symptoms. They're going to have such severe guidelines of what they can and cannot eat. So I worked with someone whose only source of protein was sea kelp because she had read that was the healthiest form of protein that there was. Now, when I talked about this case, I've talked about this case examples in other talks that I've given, and someone raised their hand and said, well, what's necessarily wrong with sea kelp? And it's a great question. The issue is there's nothing wrong with sea kelp. It's just incredibly hard to come by. So what ends up happening is the orthorexic being that rigid about her food intake is usually going to miss out on social activities and exhaust people in his or her life because there are going to be so many limitations around what she can eat and therefore what he or she can participate in. And that another newly recognized diagnosis, it's very new to the world of eating disorders, but it's ARFID, which stands for Avoidant Restrictive Food Intake Disorder. Like all eating disorders, trauma-based, and it is where people are incredibly phobic of certain textures, colors, and therefore, due to this intense fear around food, have a very, very limited palate of what they're willing to eat. Also,
would that be picky eaters?
It would be the most severe form of picky eating that you can possibly imagine, but picky enough that it means that people will miss birthday parties and weddings and dinner parties and social events.
They're functioning in some way, impairing their social life in some way.
Exactly. Like when you have that much anxiety about the food, the event is no longer important. It's just about how to get out of it.
Right.
And sometimes it can even be, I've worked with people who only take in liquid food, people who were afraid of the color red, and therefore any food that was red was a problem. I've worked with people who only eat foods that are beige. Also, sometimes I've worked with people who will only eat the foods of childhood. So, comfort foods like cheeseburgers and pizza and things like that. And that, when you first hear about that, you would think, okay, but that's just lowbrow taste or something. And we're never discounting that people, just have preference. Eating is very personal. But when someone is that limited, that rigid, that anxious about what they're willing to eat and are only willing to eat these foods of childhood for a very specific therapeutic reason, and they are stressing out and exhausting the people in their life, that is where it becomes a full-blown disorder.
And, when you're saying things like rigidity and obsession, I think that some of my clients with obsessive compulsive disorder, OCD, there might be a lot of overlap between those kinds of people who have this rigid thinking, I can only do this, and if I don't, something bad will happen. Do you see overlap in those two?
Absolutely. An eating disorder diagnosis never exists on its own. So we are treating for depression, we're treating for anxiety, we're treating for PTSD, we're treating OCD, we're treating various personality disorders. The eating disorder is really just the symptom, just sort of like in substance abuse. The drug of choice, the substance abuse problem is the symptom of a different underlying condition.
Yeah, yeah. Um, so that was really informative, and I want to shift a little bit in thinking about, because I do a lot of mindfulness work, and I do a
Hmm.
lot of exercises with mindful eating, and I'm curious to know from your standpoint, do you think something, well, first of all, how would you describe mindful eating? What is it? And do you think that people with disordered eating or eating disorders are really lacking in mindful eating skills?
Absolutely. What I want, before I go on to answer that question, I realize I need to add in another explanation of another very large category of eating disorder, which is binge eating
Oh,
disorder.
yes, right.
And because that is what
Sure,
really ties into the
sure.
mindfulness piece. Binge eating disorder is when people eat incredibly large quantities of food and there is no compensatory behavior. So unlike bulimia, there is no effort or there's no behavior directly afterwards to compensate or expunge those calories. Now, don't get me wrong, a lot of times when people struggle with binge eating disorder, they are of the most restrictive mindsets. It's usually never really intended. Sometimes binges are planned, but not always. But the idea that there isn't an immediate behavior that comes afterwards to just erase and eradicate the behavior that's just taken place. So what can often happen is people in with struggling with binge eating symptoms can, but not always, but can live in larger bodies because of that larger intake of calories that's taking place regularly. Now, to get to the mindfulness piece, yes, a lot of times I use binge eating as an umbrella term because binging can be just sort of mindlessly eating all day long. Just not being present with yourself, not being in tune with yourself. I've worked with people struggling with binge eating disorder who never really had one big eating event throughout the day. It would be just sort of mindlessly grazing or overeating at meals. And for them, mindfulness training was of enormous value to get them to be more present with themselves, their bodies, and their behaviors.
And what are there specific things or very practical tools in terms of mindful eating, that some advice you can give to people about how to easily implement mindful eating? Because, it's very hard to eat a meal mindfully if you're at home and you have kids and things are going on and this is happening and that's happening. You're getting up and down and you're all over the place. So while it is an extremely useful tool, how do you practically implement that when so many other things might be going on in your home, if you have a family and multiple things happening in the house at once?
My answer to that would be to do the best you can. When you have children, it's very unpredictable what your day or your time or even your meals sometimes are going to look like. But making mealtime a priority, it is putting huge efforts into prioritizing your self-care. So, taking the time to eat with your family, eat at a table rather than in front of the TV or on the go. I basically would say never eat on the go unless you really don't have a choice, because you still have to feed yourself. If but if you can really carve out the time 3 times a day to make mealtime or even snack time something that's important, it can increase your mindfulness in well, not only with regards to your meals, but in regards to everything that you do. Just taking time to carefully sit at a table, make sure there's no other distraction, make sure your cell phone is off, or that you're not simultaneously listening to music, or maybe taking time to eat with someone. If you can eat with your children, that's ideal, because that sends a great message of self-care to them. But also, even if you're at work, maybe eating lunch with a coworker or something, so that you are engaged, present in a conversation with them. Also, I think conversation is the most natural way to pace yourself during a meal, because then it just sort of flows organically, the rate at which you eat your food. And I don't really um, coach people that often on how to eat. That's really what I sort of encourage them to reach out to their dietitians about. But I'm always trying to get patients to be more mindful of themselves. And, some of my patients will even meditate for 5 minutes before they sit down to a meal. And I think if they can do that, that's great.
So it sounds not eating on the go, I think is a useful, because if you're on the go, you're not mindful.
Yeah, I mean, you're looking where you're going. You're not, how could you be present with yourself?
Setting
How could you be
aside
mindful?
time just for eating. That's really good advice. And so now that we're in COVID pandemic, not just with my own clients, but just memes that are coming up and friends and my own waistband, there have been a lot of challenges being in the house one way or the other. Have you seen things coming up in terms of people having a hard time eating or staying on track or grazing, or what have you seen given the current climate right now?
Actually, I've seen people really struggle. I've had a few patients refer to this time as having been a great shut off that's actually increased their mindfulness. I'm thrilled. They're cooking for themselves 3 times a day, so they feel like they're eating healthier. I'm delighted and happy for them. But for most of my patients on my caseload, that is not the case. It's really more of people finding excuses to use any symptom possible. Every symptom right now can sort of be justified because we're living in this incredibly unsure, chaotic time. So I have patients who are finding themselves eating all day long, which is a binge for sure, as under that umbrella term that I defined earlier. There are a million and one excuses to binge. Well, I'm bored, I need entertainment, so I'm going to eat all day long. And there, as if there are no consequences to that. But then there are also people I'm working with who have every excuse right now to restrict because it's a way to get through the day. It's a way to not have to feel your feelings and feel the anxiety and the uncertainty of this time. I have patients who have exercise equipment in their homes that they're able to overuse. And why not? I have nothing else to do. So I'm just really trying to increase everyone's mindfulness and realize that it's still a time to take care of yourself, even though it's a time of flux. And if you are mindful about yourself and your body, you're gonna know when you're exercising too much. You're gonna know when you're making excuses to restrict. You're gonna know when you're eating all day or long, or when you're overeating. So, I've been trying really hard to, with sympathy and compassion, explain to my patients that I get it. I'm bored too. It sucks. We're cooped up. It's not an easy time, but it's still always a time to take care of yourself.
Yeah. And what are some, just for people who might not be aware if they're struggling with disordered eating, or not aware that it's a problem, or if there's a family member who they're unsure if it's a problem, are there any signs that someone would show to their family members, or even recognize within themselves, where it might be a red flag that this is problematic and maybe I should reach out to a mental health professional?
So warning signs, you mean that, oh, okay, that's a really good question. Um, I think that really, going with your gut on these things is very, very important. If something doesn't feel right, there's probably a reason that you're having those knots in your stomach, around that person. Like something doesn't feel right. If I would say a great red flag is someone who never seems to be hungry. They seem to have always already eaten, even though, they stopped by to have lunch with you or something. I mean, people aren't really stopping by now, but that can be a thing. When you are avoidant of food and in a restrictive mindset, you're going to try very hard to avoid any sort of social interaction that's centered around food. People who appear to be over exercising probably are. People who are, not skipping a day of running, even if there's a blizzard outside, that's something to be aware of. I also think people, going to the bathroom after every single meal, or pushing their food around their plates, and never really seem to eat more than 2 bites when they're in the company of others. Sometimes these can be warning signs. I mean, anything can happen. Someone could be having a bad day. We don't want to jump to conclusions, but I think if you notice these sort of things happening over and over and over again, binge eating is not something you're going to spot usually as often, because most binging occurs in secret. But if you're with someone who never seems to eat meals, that could mean that they are eating in secret on their own. I mean, there's so much secrecy with eating disorders because there's so much shame that we're not always going to spot the signs. But if you feel like something is off and you notice a pattern, there's probably a reason that you're picking up on that pattern. I can tell you that I had a dear, dear friend whom every time we went out to eat, anytime she came to any sort of dinner party, social engagement, would just pick play with her food, move it around the plate, never had more than a bite. And, her whole life, people were always joking and saying, oh, you eat like a bird. You're never hungry. And she one day told me that she had serious anxiety about eating in front of people because she thought they were going to judge her for her larger body and, sort of fat shame her. And so because of that, she was actually afraid to eat in front of people. So all of her real eating, whether it was just regular food consumption or binging, was taking place in secret, and she barely ate in front of others. But it was so noticeable. I never confronted her about it because she's a friend, but she eventually came to me because she knows I treat eating disorders and asked me, is this normal? I said, no, you really should be able to comfortably consume food in front of people. That is a problem if you can't. So she was, I was able to refer her out and get her some treatment, and she's doing much better today. But that actually was a warning sign. It was just noticeably picking at her food and moving it around her plate anytime she was with others, or a meal in a public setting.
Yeah, and again, the anxiety about the social evaluation of others, and how a mental health provider would be the best course of action in a situation like that.
Mm-hmm.
So I want to end with a final question that I like to ask all experts and professionals in certain areas, and that is, how good are you at following your own advice, especially when it comes to mindful eating?
I feel like I've been much better before the pandemic.
Our own.
I feel like much better before the pandemic. I have definitely found myself mindlessly eating, and I've, just like anybody else, really trying to keep myself in check and remind myself that, you still have to take care of yourself, even though, there's food is not entertainment, even though, sometimes it is, cooking for others is a lot of fun and such, but, there's no reason to eat between meals just because, I'm home working. So, so I feel like in the real world, I'm very good about practicing what I preach. And now I'm having to work a little harder.
So you normally give yourself an A, but now you got a B minus.
Yeah, B minus sounds about right. I might be riding the B minus C plus, but we'll stay B minus. Makes me feel better. So.
Well, that's good. Well, that's good. You're not failing, and that's the important.
I'm not failing. Yeah. And I just want to let you know that so I have my own private practice, but I also represent an amazing eating disorder facility, which is a higher level of care. So I'm seeing patients on the outpatient level. But what we offer at Center for Discovery that is still up and running now is, sorry, there's lots of car horns coming by. It's still New York City. We offer higher levels of care, residential treatment, partial hospitalization treatment, and intensive outpatient treatment. So for people who have the time to take leaves from work or school, which is very easy to do right now since people are all working remotely and studying remotely. If your eating disorder is really getting that severe, where it's really impacting your life and impacting your relationships and maybe affecting your finances and your jobs. I mean, it can be expensive to binge eat. It can be expensive socially to be restrictive, to not have enough energy to participate as well at your job or concentrate as well as your job because you're not nourished. I mean, there is a major cost to having an eating disorder. So sometimes, I think the first step is outpatient therapy for sure. Find a therapist with a specialty in eating disorders, connect with that person and begin the work. But sometimes if the eating disorder is that out of control, a higher level of care is necessary and really of tremendous value.
So if people were interested in Center for Discovery, they would go to the website and contact through there?
They can also reach out to me. I am a resource, happy to link anybody to our admissions team. But yeah, going to the Center for Discovery website is a great first step, and there's a 1-800 number to call and set up an assessment.
Thank you so much. I am with Denise Limongello. She is available in her private practice to treat eating disorders, disordered eating, and if anyone needs higher level of care or outpatient treatment, you can visit Denise and the rest of the staff at Center for Discovery website. Thank you so much for being with me, Denise.
Thank you for having me.
Have a mindful eating day.
I shall try. Thank you. You too. This was
Bye-bye.
great.